Hi, my name is Greg Carr. I'm a physical therapist with Heartland Rehab. I've been a physical therapist for 16 years, about the last 10 years with Heartland. I was educated at Northeastern University in Boston, Massachusetts. ASTYM is an instrument-based soft tissue procedure that's designed to stimulate healing of tissue. It promotes the body to reabsorb scar tissue and stimulates healing with degenerative tissue. It's used for work-related injuries, it's used for athletic injuries, it's used for anybody who competes in sports or athletics or any type of activity who has pain and then the symptoms don't get better. Typically a treatment lasts about 3 to 4 weeks. We usually see pretty good results after the first 2 to 3 weeks, but every case is dependent. The actual session lasts up to an hour. We only use about 15 minutes per body part for treatment, so it's a prescribed and dosed kind of application of this procedure.
My name is Darren. I've been a physical therapist with Heartland for over 10 years right now. I graduated in Belgium from the Catholic University of Louvain in '92. When Kyle came to see us, he had massive knee reconstruction, he had severe ligament damage, and when he came in to see us, we pretty much kind of were working on range of motion and a lot of strengthening, and then we incorporated ASTYM treatment as well to kind of improve his functional mobility.
He mentioned to me that I would be a good candidate for the ASTYM process. I dramatically increased my ability and movement in my leg, so I really saw a dramatic change from the time in just the 13 visits where I'd done almost 45 visits at another physical therapy place. Just in a short amount of time was able to gain 28%.
Yeah, so Kyle, when he came to see us, he had about 120 degrees of flexion in the left knee, and by the time of discharge he had about 140 degrees of flexion. He was not able to squat functionally, pretty much kind of going down on his knees, which is something that he can do right now. So his functional mobility and the way he's going through his daily activities has definitely improved. I've been working with Jill for about 2 years now. She's been a patient of mine for different kind of injuries. She's a pretty known volleyball player in the Jacksonville community. She's actually a hairstylist as well, so she actually has a lot of issues with her left arm, which is her dominant hand. And she's actually a left-hand hitter as well in volleyball.
Well, Ward was a friend of mine that I played volleyball with, and one day I told him about an injury I had. I played a tournament the weekend before, and it was a rainy tournament, so the ball was heavy and my shoulder hurt, and he showed me a stretch and it felt better immediately. I came to him at Heartland as a self-pay patient, and he got me back in action, back at work, back playing in no time. It was the best therapy I'd had. I normally tend to go the alternative way with yoga and stretching and stay out of the doctor's office, so this was huge for me to come to Ward. I really did see a big difference.
We usually treat, even if it's a quad, we'll try to treat the whole leg. So we usually start down at the foot. We use 3 tools. This is the localizer here. We use it on smaller surfaces. So we go over, do a series of strokes. We'll follow that with the isolator here. We go back through the same sequence. We're not only working on the problem area, but the surrounding areas as well. It's all kind of linked together. So now we're going over the patella tendon and the quadricep. Again, a little bit of micro trauma, a little bit of blood cascading over that tissue to stimulate the healing process. We do sometimes get bruising. It's fairly rare. After we're done with the ASTYM, we like to have them stretch and move in ways that they normally move.
I would highly recommend the ASTYM therapy to anyone, and I had come back for another injury and had great results with it as well.